So now we will study about the ECG abnormalities. So we will start it with the atrial flutter. In atrial flutter, the heart rate is between 350 to 300 per minute, and in ECG we can see the sawtooth pattern. You can see the sawtooth pattern, but here the QRS complex, see the QRS complex, QRS, this is the R wave, R, but the interval between the RR will remain the same, the distance will remain the same, that is 2 to 3 boxes. It will not change, and there is a sawtooth pattern. The heart rate range is 250 to 300 per minute. Then next is atrial fibrillation. In atrial fibrillations, here we have the fibrillatory waves in between the QRS complex. The QRS complex is present, but there is no P wave. In spite of the P waves, there is fibrillatory wave before starting the QRS complex, and the rhythm is also irregular. As you can see, there is only one box between the RR interval. Here there are 2 boxes, here there are 2-3 boxes. So this is the atrial fibrillations in which there are the fibrillatory waves and there are no P waves. The other one is the ventricular tachycardia. In ventricular tachycardia, there are tongue-like structures. See the tongues. Here there are tongue-like structures, and the heart rate is between the 100 to 250. The QRS is wide, rhythm is regular, but there is no P wave, no T wave. As we can see, there are wide QRS complexes, there are tongue-like structures, and there are no P wave, there are no T wave. So, and the heart rate is between 100 to 250. And in first degree AV block, there are 3 types of the heart block: first degree, second degree and third degree. In first degree AV block, what we have to monitor in ECG is the PR interval. This is the PR interval, this is the P wave, this is P. So this is a PR interval. The normal PR interval is range between 0.12 to 0.20. So if this PR interval is prolonged, so it means the patient is in first degree heart block. As you can see here, usually the PR interval ends in between 3 to 5 small boxes, but if it took long, if this space increase, if it is more than, if the PR interval is more than one large box, then the patient is in first degree heart block. And if we will not treat the first degree heart block, then this interval will increase and there is prolonged PRP, there is prolonged PR. And in third degree prolonged PR with missing QRS, and if we got the patient in third degree heart block, then multiple missing QRS complexes, and we can see the P wave but no QRS.